Hello, and thank you for attending today's video. The topic today is mistletoe therapy for cancer support and prevention. I am really excited to talk to you about mistletoe treatments and its benefits as a cancer support treatment because we have seen really amazing results, in clinic with this type of therapy. So this video is geared towards either patients who are actively living with cancer, those who have been diagnosed with cancer and are currently or about to undergo conventional treatments. It's also good for patients who are palliative and maybe conventional medicine just doesn't have any answers for them anymore and they're looking for an alternative treatment. And it's also geared for patients who have survived cancer, a cancer diagnosis, and who would like to prevent any further recurrences. And it's also geared towards patients who have a long family history of cancer and would like to prevent getting cancer themselves. So for those of you who don't know me, my name is Dr. Sandra Miranda. I'm a naturopathic doctor and I've been practicing in private practice for about 18 years. I'm also the owner and the founder of Miranda Naturopathic Clinic, a multidisciplinary clinic located in Ajax, Ontario. I am happy to say that we have been servicing the community of the Durham region for the past 16 years. I never thought I would be having cancer as one of the focuses in my clinic, but unfortunately it's inevitable. The number of cancer patients that we see at the clinic who have already been diagnosed or who would like to prevent a recurrence, the numbers just keep growing every day. So this is why I decided to make this video, to share with you all the information that I know on this wonderful therapy that can help so many people. So our agenda for today is, I'm first going to introduce you to a concept called Integrative Oncology. So we're going to talk about that. Then we're going to talk about exactly what is mistletoe therapy, how does mistletoe work, what do some of the studies actually show in regards to its benefits, and what types of mistletoe treatments are available and who exactly can mistletoe help. So I do need to start with a disclaimer. So although mistletoe is approved for injectable use in other jurisdictions, it is not approved for such use in Canada, as well as any injectable therapeutic information described in this video. Mistletoe therapy is considered a quote-unquote off-label use by specialists, so please keep that in mind. Cancer is a global problem. And the total number of people affected by cancer, like I said before, it continues to grow. The graph that you see in front of you shows the projected new cancer cases expected in the United States. As you see, every year, starting from 2010, the rates of cancer diagnosis is increasing, and the expectation for 2020 is to be even higher than any of the other years. But we also see that it's a global problem. So for example, I have some numbers here. In 2012, there were 14.1 million new cancer cases, 8.2 million cancer deaths, and 32.6 million people living with cancer. So the numbers are really unimaginable. The Centers of Disease Control and Prevention, also known as the CDC, they expect to see an increase in the following cancers over the next few years. Melanomas, which is the deadliest form of skin cancer in white men and in white women. Prostate, kidney, liver, and bladder cancers in men. And they're also expecting to see an increase in lung, breast, uterine, and thyroid cancer in women. Um, Now, the good news is that thanks to the big advances in conventional treatments, there is also an increased amount of survivors from cancer diagnosis, which means that there's a lot more people living either with active cancer right now than ever before, or people who have been quote unquote cured, of the cancer, and now they're cancer-free, but still needing to prevent recurrences. So here in the chart, we see, the increased, the numbers of cancer survivorship. So again, the expectation, going towards 2020 and going towards 2030 is that those numbers are going to continue increasing. Many of these people that have survived have, of course, undergone conventional therapy. The problem is with conventional therapy, which includes chemotherapy, it includes surgery, radiation, is that many of them have been left with a big list of health concerns that can tremendously impact the quality of life that they have. So yes, we're seeing a lot more people that are surviving cancer, but the question is, what kind of quality of life are they really having? So 1 in 4 cancer survivors report reduced quality of life due to physical problems. 1 in 10 cancer survivors report reduced quality of life due to mental and emotional problems. And individuals who receive a lot more aggressive and invasive treatments and reduced quality of life during treatments are at increased risk of problems with long-term quality of life problems as well. So, so this is a really important thing to consider because, it's great that people are surviving cancers, but we also want to make sure that we are helping them in improving their quality of life. Okay, so what is integrative oncology? Integrative oncology means the ability to be able to integrate both types of medicine. So we're talking conventional medicine, which is surgery, chemotherapy, radiation, so the typical conventional therapies that people usually go for, and also being able to combine them with the benefits of more natural therapies. So that can be, for example, biological agents such as, some immune herbs or supplements, detoxification programs, diet, lifestyle, mind-body interventions. Maybe it's meditation or yoga or some cognitive behavioral therapy. So integrative oncology is the ability of being able to integrate, to combine the benefits of both types of medicines. And the newer research shows that patients do a lot better, and they have a lot more chances of not only improving their quality of life, but also being able to tolerate the side effects of these harsh conventional treatments, and just have better chances of survival when they do integrate the benefits of both types of medicine. So as we see here in the chart, the actual goals of conventional medicine really is just to reduce the cancer burden, interrupt the course of disease, and treat locally affected areas. However, the goals of more naturopathic medicine is to actually promote wellness, is to create an environment in the body that the body is not going to want to produce the cancer cells from growing back again after conventional medicine has finished with their treatments. So this is really, really important because we don't want to just get rid of the cancer cells temporarily. We want to be able to teach the patient and just change their internal environment so that the body is healthier and not having a system that's conducive to continue growing more cancer cells. So the goals of naturopathic medicine or natural therapies is more to strengthen the patient, to enhance immune function, and to overall promote wellness. So one of the therapies that we use with these objectives in mind is the mistletoe therapy. Okay. So what is mistletoe? So mistletoe is a plant, also known as Viscum album, that has a long history, over 2,000 years of safe use in traditional medicine. It grows on oak trees, which are considered sacred in many cultures. Mistletoe therapy is considered a supportive treatment, and it can positively improve quality of life of people during and after conventional therapy. So this is really important. I see a lot of patients in practice who are scared of receiving chemotherapy, and they're scared of receiving radiation. And then I talk to them and I say, maybe there's a way of combining both types of medicines. Maybe there is a way that we can give you the supportive therapy so that you can tolerate, all these conventional treatments as well. So again, people really like having options, and that is definitely a very good option for people. It decreases the side effects of chemotherapy and or radiation without interfering with the effects of these treatments. And that's really important for people to know. Mistletoe therapy does not interfere with the effects of chemotherapy and or radiation in any way. So unlike some doctors may tell you, mistletoe therapy is one of the most researched integrative cancer therapeutics. Studies show that it will positively impact quality of life, decrease side effects of conventional therapy, and overall increase survival. So, and it can be used in either case, in cases where we're trying to cure cancer and in cases where patients are already considered palliative. Mistletoe therapy has a place in both types of treatments. While toxicity has been observed with this herb, it's only been observed if you ingest a large quantity of the mistletoe. The small dosages that are normally used during these naturopathic therapies, either subcutaneous or intravenous, we're going to talk more about that. These small dosages are extremely safe and effective at improving quality of life and survival. So how does mistletoe actually work? Mistletoe effects in our body are best summarized in 3 different types of effects. So the first effect is just in our immune system. Mistletoe has an impact on the number and the activity of certain immune cells that will help your body to fight the cancers. So it's going to have, for example, an impact on something that we call natural killer cells and other immune cells that will come and help to fight off that tumor or that cancer cell. It also has an overall effect in decreasing inflammation, which many times is a big aggravator during cancer. It also has what we call an anti-angiogenic effect. So what does that mean? That's a big word. What that means is that it has an effect on cancer cells because after even 1 dose of mistletoe therapy, there's a destruction of the blood cells, all these little blood vessels, going towards the tumors for the next 35 days. Therefore, it stops the delivery of nutrients and factors that the cancer cells need to grow. This is what we call an anti-angiogenic effect. It also, and in my opinion, probably one of the main effects that it has is that it stimulates endorphins and it normalizes cortisol curves. It stimulates beta endorphins. So what are endorphins? Endorphins are that neurotransmitter that makes us feel good. And because it also normalizes the cortisol curves, pretty much what it does is it helps with moods, it helps with energy, and it helps with our demeanor, which, as we know, these are things that can be very much affected, in people who have been diagnosed with cancer. This stress and depression, just the reduction of the stress and the depression alone, can help the patient to have a better ability to beat cancer, because that alone is going to help to boost up our immune system. Mistletoe helps to stimulate endorphins. And what this means is that just patients in general, after receiving mistletoe therapy, they're going to feel a lot better than what they were feeling before. Okay, so now let's actually go through some of the studies to see exactly what they show. So this chart is showing an overview on 5 retrospective studies. This one is specifically showing the effects of mistletoe on colorectal cancer patients, lymphoma and leukemia, breast cancer, melanomas, and pancreas. And it's showing the percentage rates of survival of patients that have either received the mistletoe or patients who have not received the mistletoe. So the ones in red are the patients who have received the mistletoe, and the ones in black, the ones that didn't. And look at the numbers as to what are the chances of patients surviving over 10 years. A little bit more, 50.8% versus the 41.9%. The lymphoma and leukemia is the most, has the most dramatic effect. So the people receiving the mistletoe therapy, 81.4% of those patients were able to survive over 10 years, from receiving the initial diagnosis, versus the people from the group that did not receive the mistletoe therapy, only 29.3%. The same thing with breast cancer, 86.1 versus 61.2. Melanomas, 88.5 versus 57, and with pancreatic cancer, 13.6 versus 2.5. So this retrospective study, which overviews a few of the studies, definitely shows that we can have an increased survival rate, of over 10 years in the different types of cancers. What studies also show that even though we can have an effect in the stage 4 cancers, the biggest improvements were seen in the earlier stages, in stage 1, in stage 2, and stage 3. So the big take-home message with with these studies is to try to get the mistletoe therapy as quickly as possible. In this study, we see the influence of mistletoe. Helixor is just the brand name that we use at the clinic, on adverse effects on breast, ovarian, and lung cancer therapies. And here what we're seeing is that the green is the people who received the mistletoe therapy versus the blue is the group of people that did not. So people who did receive the mistletoe therapy had definitely a lot less of the adverse effects compared to the people who didn't. So a lot less of the adverse effects from conventional treatments. And here, these two is showing really serious adverse effects. So again, even the serious adverse effects, we see that there is less of them in people who did receive mistletoe treatments versus the ones who didn't. This chart shows the influence of mistletoe on the quality of life. So again, the green one is showing the people who have received the mistletoe therapy and is showing that they have a better score in terms of their quality of life, as opposed to the blue group is the people who did not receive the mistletoe. So all the greens are higher, and that shows that they have better scores in terms of quality of life. So which quality of life variables are actually improved with mistletoe? It can be the ones that have been studied and monitored. Is their energy level, how well are they sleeping, so insomnia, lack of appetite, nausea, pain, physical activity. So as you know, these are very, very common problems when someone has been diagnosed with cancer, especially if you have the more advanced stages of cancer, and which is even worsened by the chemotherapy and the radiation. So receiving the mistletoe during these treatments can greatly impact and help you, with your quality of life. So what are the different types of mistletoe treatments available? Well, from the company that we get it from, Helixor, there are 3 different types of mistletoe. We have the A, the M, and the P. The M is the most common one, and this is the one that's used to treat most of the different types of cancers, with a few exceptions. So the P one is used to treat things, for example, sarcomas, or CLL, which is chronic lymphocytic leukemia, and HL, non-Hodgkin's lymphoma, or even the Hodgkin's lymphoma as well. The A is it has a little bit less of the active ingredients, so it's kind of like a weaker type of preparation of the mistletoe. So this one is used for problems such as brain tumors, whenever there's like a large lung tumor, or for prostate cancer as well. And it's also used for patients who are just very sensitive. There's some patients who come in and they just have the history of a lot of sensitivities. They don't react well to different medications. So with those patients, we're a lot more careful, and we may just use the mistletoe A. The therapy can be administered in two different ways. It can be administered subcutaneously, which are very superficial injections done in the abdominal area, in the lower abdomen usually. And those are usually treatments that are given 3 times a day. Unless the stage of the cancer is more advanced, it can be done even daily if needed, but usually most patients will get it 3 times a week. Or we also have the option of doing the Mistletoe intravenous, which is IV. And those are usually reserved for cases that are a lot more advanced. But there are 2 different options. And then, of course, depending on the case, sometimes we combine both of them, the subcutaneous as well as the intravenous. So in conclusion, as advances keep happening with conventional treatments, and therefore there's a growing number of cancer survivors living, we find that a lot of these people can be left with the side effects of conventional therapies. So there is a need for cost-effective therapies that will help improve not only just survival rates, but also address the many issues like quality of life and long-term treatment effects that are left from the conventional treatments. So mistletoe therapies have been safely used for over 2,000 years, and there are thousands of studies to back up their benefits. Really important point. The main benefit is improved in quality of life and in reducing the side effects of conventional therapy. There is evidence to support that it improves overall survival, but the magnitude of its effects is still uncertain. And there is little evidence to support mistletoe as a primary therapeutic option to treating cancer. Okay, so those are the main points, the main take-home messages for you from this video. So if you would like to find out, like if you are actively dealing with cancer, if you're about to undergo conventional therapy, or maybe you have a long family history of cancer and you're trying to prevent, or maybe you're already a cancer survivor and would like to just prevent recurrences. You don't want to just wait. Every 6 months for the first 5 years, usually you have to go back and get another imaging test done. If you want to be more proactive and let's try to improve that internal environment to prevent any recurrences, and if you'd like to talk to us about it to find out if maybe you are a good candidate for this type of therapy, then please feel free to give us a call. We offer 10-minute free meet and greets. We're happy to meet with you, find out more about your case, and then talk to you as to whether or not mistletoe therapy is the right treatment for you. So thank you for attending. I hope this information was helpful, and I'll talk to you soon.